Let me ask you something personal. When was the last time you felt genuinely secure about your healthcare costs? Not just fine, not just managing, but actually confident that you're not overpaying, that you're getting everything you're entitled to, and that your Medicare is working the way it's supposed to. If you had to think about that for a moment, this video is for you. Here's something that stopped me cold when I first started working with Medicare beneficiaries 15 years ago. The average senior on Medicare is paying somewhere between $3,000 and $7,000 more per year than they actually need to. That's not a small number. That's a vacation you could take. That's medication you could afford. That's money that could go to your grandchildren or your retirement dreams. And the reason most people assume? Complicated forms, hidden fees, fine print designed to confuse you. But in all my years working with seniors, I've learned that's only part of the story. The real money wasters aren't deliberately hidden. They're ordinary, they're in plain sight, and most seniors never claim them, not because they can't, but because they simply don't know they exist. My name is Sarah Chen, and I've been a licensed Medicare advisor for over 15 years. Today, I want to walk you through the 7 Medicare costs seniors completely stop paying once they know about them. And I promise you, number 1 will surprise you. Most people assume it's about switching plans, but switching plans, that's only number 7. Before we go further, if you find this helpful, please hit like, subscribe, and drop a comment below telling me where you're watching from and what healthcare challenge brought you here today. I love hearing from the seniors in this community, and your comments help me make videos that actually matter to you. Now let's get into it. Coming in at number 7, unnecessary plan switching costs. Now before you think, I'm staying with my current plan, stay with me, because this one affects even people who aren't changing plans. Here's what Medicare doesn't openly advertise. Every time a senior switches Medicare plans, they lose certain protections. Your grace period resets, your network changes, your doctor relationships shift. And what most people don't realize is that switching plans to save $5 or $10 a month often costs you $200 or $300 in disrupted prescriptions, out-of-network visits, or coverage gaps you didn't anticipate. I've watched patients switch 3 times in 2 years, each time thinking they're saving money, each time ending up paying more because they didn't understand the true cost of switching. But here's the beautiful part about understanding this. You don't have to switch. In fact, most seniors save money by staying put, by maximizing what they already have. And that brings me to number 6. Number 6 is something that walks into my office in disguise almost every single week. Preventive services that seniors simply don't claim, and it costs them thousands over time. Here's a fact that shocked me when I first discovered it. Medicare covers 100% of certain preventive services. That means 0 copay, 0 deductible, nothing. Your annual wellness visit, your cancer screenings, your diabetes screening, your cholesterol check, your flu shot, your pneumonia vaccine, all completely covered, no cost to you whatsoever. But according to the CDC, nearly 40% of seniors never use these benefits. They either don't know they exist, or they think there's a copay, so they skip them. And then what happens? A health issue that could have been caught early for free gets discovered late, costs thousands to treat, and suddenly their healthcare spending jumps dramatically. I had a patient, Margaret, who came to me at 72 thinking she was paying too much. We reviewed her care and I said, "Have you had a colonoscopy since you turned 65? She hadn't. We got her scheduled. It was completely free. They found a polyp early. Surgery cost $500 out of pocket. Without that free screening, it could have become cancer. Cost would have been 6 figures. The fix for this is simple. Call Medicare at 1-800-MEDICARE or visit Medicare.gov and ask your counselor about your free preventive benefits visit. Get it scheduled. Use what you've already paid for. And remember, that's only number 6. The costs ahead hit harder. Number 5 is something I see costing seniors thousands of dollars annually, and it's completely preventable. Medication costs when they're eligible for assistance programs they've never heard of. Here's the situation most seniors face. After you hit that Part D donut hole, after you've spent around $4,700 out of pocket on prescriptions, most people just accept the high costs. They assume that's just how it is. But what Medicare doesn't make obvious is that once you hit catastrophic coverage, your costs drop dramatically. And more importantly, there are multiple assistance programs available simultaneously. The Extra Help program alone helps 1.5 million seniors with prescription costs. The state pharmaceutical assistance programs, manufacturer copay assistance, 340B programs. There are 7 major assistance programs available, and most seniors qualify for at least 2 or 3. I had a patient, Robert, paying $400 a month for his blood pressure and diabetes medications. $400. When we applied for the Extra Help program, his costs dropped to $35 a month. The same pills, the same pharmacy, the only difference was knowing the program existed. Here's what makes this tricky. These programs aren't advertised during enrollment. Medicare doesn't automatically sign you up. You have to know to ask. You have to know to apply, and most seniors never do. The fix: go to benefitscheckup.org or call your state health insurance assistance program, or SHIP, which is free counseling specifically designed for this. If you haven't done this in the past year, you're likely leaving hundreds of dollars on the table every single month. But remember, medication assistance is only number 5. What comes next is far more dangerous to your finances. Number 4 is something that genuinely shocks seniors when they learn about it. The copay and cost-sharing limits that exist in Medicare but aren't automatically applied to your account. Here's how this works. In original Medicare, once you've paid a certain amount out of pocket in a calendar year, your costs stop. But, and this is critical, Medicare doesn't automatically cap your costs. You have to know you've hit the limit, and you have to actively confirm it. More importantly, many seniors don't realize that Medicare Part B has different cost-sharing rules. Once you've paid your annual deductible of $240, Medicare covers 80% of your approved charges. You pay 20%, but if you go to a non-participating provider, you could pay more. And if you didn't know they were non-participating, you just paid 35%, 40%, sometimes 50% more than you should have. I had a patient, Dorothy, go to what she thought was her doctor's office. The building looked right. The staff seemed familiar, but it was a newly opened satellite location she'd never visited. The provider wasn't in her network. That one visit cost her $400 out of pocket instead of the $50 copay she expected. She didn't know to check beforehand. Here's the thing that kills me about this one. Medicare already has this information. They already track your out-of-pocket costs, but they don't proactively tell you. You have to log into Medicare.gov and check it yourself. The fix: before any procedure, before any specialist visit, call Medicare and ask, what's my actual out-of-pocket cost going to be for this service? Ask the question. Don't assume, don't guess. Ask, and you'll know exactly what you're paying. And remember, that's only number 4. The next ones cost even more. Number 3 catches most seniors completely off guard, and it's one of the most expensive mistakes I see. Income-related surcharges that many seniors are paying but could have removed with a simple appeal. Here's the situation. If your income is above a certain threshold, Medicare automatically adds extra charges to your Part B and Part D premiums. These are called IRMAA surcharges. For 2024, if you made more than $9,000 a year 2 years ago, you're paying more. And that extra cost can be $100 or $50, sometimes $300 per month, depending on your income level. But here's what most people don't know. Life changes. Your spouse passed away. You had a one-time capital gain from selling your house. You got a bigger Social Security check. Your income situation genuinely changed. And Medicare allows you to appeal your IRMAA surcharge based on a life-changing event. I had a patient, James, who was paying an extra $180 a month because of a capital gain from selling his business 3 years prior. One-time gain, but Medicare was still charging him based on that income. We filed an appeal, documented the life-changing event, and his surcharge was removed within 6 weeks. That's $160 a year he got back. The challenging part about IRMAA surcharges is that they're applied automatically and appeals must happen within a specific window. Miss that window, and you're locked in for the year. The fix: check your Medicare summary notice every year. Look for Part B and Part D premium amounts. If you see surcharges and your life circumstances have changed, contact Social Security immediately. Don't wait, file that appeal. And remember, this is only number 3. The next 2 impact your actual healthcare coverage and are even more expensive. Number two is something I genuinely wish more seniors understood: the supplemental benefits available in Medicare Advantage plans that go completely unused. When Medicare Advantage plans became popular, they offered the standard benefits, right? Hospital, doctor, prescription drug. But over the last 5 years, they've started adding something called supplemental benefits. Dental, vision, hearing, transportation, over-the-counter medications, fitness programs, acupuncture, even meal delivery for seniors recovering from surgery. These aren't marketed well. Insurance companies make money when you don't use them. So seniors enroll in Medicare Advantage thinking they're getting standard coverage, and they never realize they have $1,500 in free dental coverage, or $2,000 in free hearing aid coverage, or $100 monthly for over-the-counter products. I had a patient, Linda, who needed a crown. She was prepared to pay $1,800 out of pocket. When we reviewed her Medicare Advantage plan, she had $1,000 in annual dental coverage she didn't know about. Got the crown done for $800 out of pocket instead of $1,100. She saved $1,000 because she finally read her plan documents. Here's what makes this tricky. These benefits change every single year. Your 2024 plan might include acupuncture. Your 2025 plan might drop it. You have to check every year during open enrollment. The fix: during open enrollment, call your insurance plan directly and ask, "What supplemental benefits am I getting in 2025? Get the answer, write it down, use them. If your plan offers dental coverage and you have teeth, use it. If they offer transportation and you need rides to doctor appointments, use it. These benefits are part of what you're paying for." And now the number one cost: not skip benefits, not surcharges, not even missed programs. It's something far more fundamental that most seniors never think about. The number one Medicare cost that seniors stop paying once they understand it isn't a specific fee or charge. It's choosing the wrong plan type entirely because they never assessed what they actually need. I know that sounds almost too obvious to be taken seriously, and that's exactly why it's so dangerous. Here's the situation. A senior turns 65. Medicare happens. They get a flyer in the mail. They flip through it. They see Medicare Advantage. Promises include zero copays, dental, vision, sometimes even gym memberships. Sounds amazing, they enroll. But they never ask themselves the critical question: where do I actually get my health care? If you see a doctor outside the Medicare Advantage network, you could pay 30%, 40%, sometimes 50% more than you would in original Medicare with a supplement plan. If you like your doctors and they're not in your Advantage network, you just signed up for higher costs. If you travel and want coverage outside your state, you're on your own with Advantage. If you have a rare condition and need specialists, Advantage requires referrals and prior authorization. I've watched seniors choose Advantage because of the marketing promise of dental and vision, then spend the next year frustrated because every specialist visit requires approval, every out-of-network visit costs more, and their actual out-of-pocket spending ends up being thousands higher than it would have been with original Medicare and a supplement plan. But here's where I love this problem. It's completely solvable. The moment you understand what you actually need, the decision becomes obvious. Some seniors genuinely are better off on Advantage. It depends on your situation, your doctors, your health, your budget, and your lifestyle. The danger isn't that Advantage is bad. The danger is choosing any plan without understanding which is right for you. This is why I created the Senior Health Vault channel, to help seniors make informed decisions, not the decisions that insurance companies are marketing. I had a patient, Michael, who switched from Advantage to Original Medicare plus a supplement. His out-of-pocket costs dropped from $4,400 a year to $2,800. Same healthcare, different plan, with $1,400 annual savings just from choosing the right structure. When you step back and look at all seven, one truth becomes impossible to ignore. Seniors don't lose their money in a single dramatic medical event. They lose it slowly through the small oversights, repeated month after month, year after year. Skipped preventive services cost hundreds. Missed medication assistance costs thousands. Wrong plan selection costs over $1,000 annually. These aren't just fees. These are your retirement. These are your independence. These are your ability to afford the healthcare you actually need. But here's what I love telling my patients. You don't need to be a Medicare expert. You don't need to spend hours reading government documents. You just need to ask the right questions and know where to find help. If you're currently on Medicare and you've never reviewed these 7 costs, do this today. Go to Medicare.gov, create an account if you don't have one, and download your annual Notice of Changes. That 20-page document holds thousands of dollars of insights about what you're entitled to claim. Spend 30 minutes reading it. It's the best 30 minutes you'll spend on healthcare this year. If you found this helpful, please hit subscribe and turn on notifications. I upload videos every week focused on helping seniors understand their Medicare benefits and keep more money in their pocket. I don't work for insurance companies. I don't earn commissions. I work for you, and your financial security and retirement matters to me. And please drop a comment below. Tell me which of these 7 costs surprised you the most, or tell me what Medicare challenge you're facing right now. I read every comment, and I often create videos based on what seniors like you are actually struggling with. Finally, if you're turning 65 soon, or you're already on Medicare and want personalized guidance, I've created a free Medicare benefits checklist in the description below. Download it. It walks you through every single type of benefit available to you, and it includes phone numbers and websites where you can verify you're claiming everything you're entitled to. It takes 15 minutes to complete, and seniors tell me it saves them hundreds of dollars just by making sure they haven't missed anything. Your healthcare should work for you, not against you. These 7 costs are your rights. Claim them, use them, and take your retirement back. Thank you for watching, and I'll see you in the next video.